Still on the environmental degradation and wanton destruction of forests are igniting the emergence of zoonotic diseases like Ebola, Rabies, yellow fever, Avian Influenza, and most recently COVID-19. Public health specialist Dr. Ahmed Ogwell says human life is linked to the environment and continued destruction of the ecosystem spells doom for mankind. And as Judith Akolo reports, no country is safe as long as the population explosion continues pushing humans into clearing forest for human settlements, agriculture, and mining.
The ecological balance is fast diminishing, driven by human activities like habitat destruction, overexploitation, and pollution. And as humans clear large tracts of forested land for settlement and agriculture, the displacement of animals from their natural habitats are bringing diseases closer to humans. The former Deputy Director at Africa CDC, Dr. Ahmed Ogwell, warns that the clearing of forests is increasing the possibility of animal reservoirs like fruit bats, which are the main hosts of the Ebola virus, getting closer to human populations.
That we cut down the trees, the more that we go do our agriculture in the middle of the forest, the more that we do clearing of forested areas, the more we increase the possibility that the animal reservoirs are going to be in closer contact with the human population.
Governments are being urged to reduce human interaction with forested areas and avoid disrupting ecosystems while investing in capacity building for both healthcare systems and healthcare personnel to detect and contain disease outbreaks before they spread to larger areas.
Having an isolation unit is a good strategy because it provides you with the opportunity to be able to get an individual who is exposed to a virus that is fast moving like Ebola in an area where they can be able to be looked after without risk to the population.
According to Ogwell, the Ebola outbreak in DR Congo and Uganda is an opportunity for Kenya to build the capacity to deal with the disease outbreaks were they to occur.
Having your health workers be part of the response, the actual response, which is in the DRC and partially in Uganda, it would have been very useful to have Kenyan experts being deployed to not only help in the intervention there, but also to build its capacity by being in the real life situation.
He says this, coupled by strategic communication instead of half-truths on social media, will reduce public anxiety.
As a country, my encouragement will be, let us ensure that we are prepared by good information, by putting systems into place. The screening and surveillance at our ports of entry need to be done by people who are well experienced, well exposed, and know what to look for.
One health approach where animal health, human health, and the environment work together could see a reduction in zoonotic disease outbreaks, while constant surveillance will aid in stopping the spread of diseases when they occur.
That way, all the surveillance mechanisms from all the three areas are overlaid with each other, and the country can be able to be assessing its preparedness using data from all three different sectors.
Judith Akolo, The Lunchtime News.